All right, welcome everyone to today's Pursuant webinar. I'm starting to see the attendees come into the room, so welcome. I'm glad that you could dedicate an hour of your day to cover this topic. We're really excited to have you, and so if you're just now joining us, we are covering segmentation secrets for reaching the right donors with the right message. This is a really timely topic as a lot of you are probably heading into your year-end fundraising campaigns and seeing what areas of your digital strategy you can prune and tweak to really maximize the giving spirit at the end of the year. As a reminder, we will be sharing the recording with everyone who registered. So if you have to drop early, or you had a colleague that wanted to attend, or you're furiously taking notes and not sure if you were able to capture everything, you will be getting that sent to your inbox tomorrow. So you can sit back and relax. If you have any questions that are related to the current topic or something that you maybe walked in today wanting an answer to, you can put that in the Q&A panel that's at the bottom of your screen. And we have reserved the final 10 minutes of today's presentation for your questions. But again, if there's something that is really relevant to the current topic, we may address it right when that question comes through. And if you showed up today wondering what Pursuant is, who we are, what we do, this slide encapsulates a little bit of kind of our philosophy when it comes to fundraising. Over there on the left side of the screen, we have our Giving DNA platform, and that's just a fancy term that we mean technology and analytics that we use to increase donor lifetime value, listen to your donors' preferences, find out what engagement channels your donors prefer, and really get those data insights that you need to supercharge your fundraising. And then we also pair that with what we call our concierge giving services, and that is our agency services. So those are the fundraising professionals with years of experience and strategy who can look at your data and look at your strategy and align it with best practices so that you can get your best ROI. And this is another slide highlighting the benefits of the Giving DNA platform. And so if that is something that you would like to know more about, we will be having some examples throughout today's presentation of how Giving DNA can make a tangible impact on your fundraising strategy. So if that is something that you would like to know more about and get a test drive of, you can head over to pursuant.com and you'll be able to find information about signing up for a demo. All right, without further ado, let's introduce today's presenters. So I'm Leah Davenport, and I serve as a Senior Marketing Manager here at Pursuant, and I am joined by two outstanding guests. The first is Matthew Mielcarek, who is our Vice President of Insights at Pursuant. Matthew, say hello.
Hello, everyone. Thanks for having me.
And we also have with us a special guest, Harmonie Farrow, and Harmonie serves as the Director of Annual Giving at Children's Health, and that is a children's hospital here in Dallas, Texas, a organization that is near and dear to my heart. And so she's going to be sharing with us some things that they are doing over at Children's in their fundraising program.
Hi, everyone. Good to see you today.
Yep. I should have asked you to say hi, because you probably were sitting there being like, okay, when's my cue? All right. So without further ado, we're just going to go ahead and move into the presentation today. And we are going to turn our cameras off for now so that we can focus on the content. But we are here smiling at you as this presentation moves along. All right, so Harmonie, I'd love to hear from you. So tell our listeners, our attendees, more about Children's Health and where you sit within the organization.
Sure. Thanks, Leah. I really appreciate you having me today. As you mentioned at the beginning, I am the Director of Annual Giving for Children's Medical Center Foundation, which is the fundraising arm of Children's Health, which is a full pediatric healthcare system located in the greater Dallas, Texas area. I had the pleasure of joining the foundation in March of this year, which I have to say was a very interesting time to begin a career in healthcare. The first 13 years of my career were actually spent in annual giving and donor relations in higher education. So I am still relatively new to fundraising in the healthcare arena. But I was hired by Children's at that time to come in and build a robust annual giving program. At the time, sort of at the beginning of 2020, Children's had not had an annual giving program for a number of years. Under previous leadership at the foundation, the emphasis was really on major giving and corporate partnerships. And annual giving campaigns and direct mail were in place when I arrived. I have some amazing colleagues across the foundation who were doing a wonderful job of really acquiring new donors, but there wasn't an emphasis on sort of creating a full annual giving donor experience to build the donor pipeline. But fortunately, right as I was arriving at Children's, the foundation had already partnered with Pursuant to conduct a stewardship workshop and a full 3D assessment of our constituent database.
Yeah, so thanks so much for that, Harmony. And specifically, a 3D assessment is a term that Pursuant uses really to explore a donor file that we perform on our platform. So you load your data file, and then we're able to look at both long-term as well as short-term donor and revenue trends. And so we were able to quickly detect insights from Harmonie's file. We saw a lot of gifts were transactional. We saw that retention was traditionally challenged. We saw some of the effects and impacts of siloed relationships. And as Harmonie mentioned, that's because so much of the focus had been on major gifts as well as annual giving. And not annual giving and not individual donors. I'd say that in particular, we found some headlines from that assessment that were really informative to us. So as Harmonie is a new leader joining her organization, looking to establish a baseline and determine where and how to grow, a couple things really stood out to us. And I would almost say that they were contradictory in nature. The first thing we saw over at the left is that within a few years, from 2017 to 2019, Children's Health had doubled the number of new donors giving on its file every year. We should all be so lucky. In many cases, for most nonprofits, acquisition is getting harder and harder. But seemingly for Children's Health, for this program, they were acquiring new donors at an even faster rate. A lot of that came from community events, some from direct mail, some from a seasonal program that's running right now called Boo, that is in full swing this month. And so that's great within the general level donor pool. And I would even say that those new donors had also grown overall donors on a month-by-month basis. So overall donors have also increased substantially over the past few years. But at the same time, despite that growth, if we look just at general level donor revenue, which is equivalent to the audience we're interested in for annual giving, we saw really only a modest increase in revenue. So we've doubled our new donors, we've grown our active donor file, yet revenue has only increased by about 8% over that same time period. So it felt very contradictory to us, right? We are working really hard to acquire new donors, and we are spending a lot of time and effort and money to do so. But at the same time, we're not really realizing the potential of who those folks are. it feels like relationships aren't really progressing beyond that initial first gift, beyond that initial transaction alone. And then we stumbled upon a metric that really hit that home for us. And that was specifically that 19% of those new donors that we're attracting each year are retained to the next year. I would say that that was at least half of the rate of overall donors in terms of how they are retained. And so this metric specifically hit home the fact that we're not doing a good job of welcoming our donors. We're not doing a good job of understanding who our new donors are. And then most importantly, we are not building a pipeline from new donors to our annual giving program, as well as up the pipeline to mid and major giving as well, which is how all of this should be working together. So we brought these insights from sort of our initial phase work back to Harmonie and team and landed on a fairly big conclusion together.
So I was honestly a bit shocked when Matthew shared the results of the 3D assessment with us. Those numbers are pretty convicting, but I have to say I was also thrilled because as somebody who was setting out to build a brand new program, Matthew and his team had really saved me several months of digging into data to try and figure out what the priorities for our newly formed annual giving team needed to be. It, as Matthew said, was pretty clear from the data that the foundation was doing a phenomenal job of acquiring new donors, which to Matthew's point is something that a lot of nonprofits struggle with on a regular basis. But we weren't investing in building relationships to connect those donors to our mission and bring them along on sorry about that. We weren't doing a good job of bringing people along on the journey. We were churning and burning and acquiring new sets of donors each year. And really every time we got to the end of our calendar year, we were starting over again from scratch and sort of having to recreate the wheel. So obviously we had a lot of opportunity to really improve in the area of donor retention and relationship building. But we could tell that we needed to go beyond just standard annual giving stewardship pieces, although those are still very vitally important. But we live in a time right now where companies like Amazon and DoorDash and Uber have really spoiled us. We all want the companies that we interact with to know who we are and anticipate our needs and our desires before we even know them. I am a total sucker for the Amazon suggested shopping items. You know, people who purchase this item also purchase this item. I fall prey to that clickbait all the time. And that's just what we've grown accustomed to. I mean, we can just think things seemingly and we find ads for them, right?
It's like,
so,
tell me what to buy.
Tell me what to buy. Tell me what it is that I want, please.
Right.
So we really need, as nonprofits and as fundraisers, to level up and come up with a much more sophisticated way of communicating with our constituents beyond just thinking of our donors as current donors or LIBUNTs or lapsed donors. We really need to identify with who those people are and how best to bring them on an intentional donor journey, but on a mass scale. This is a much easier thing to do for major gift officers who are probably dealing with a portfolio of about 100 people. When you're talking about creating a donor journey for 200,000 people, you have to find a way to do that efficiently, but in a high-touch manner. And honestly, this is not unique to healthcare or to hospitals. I would argue that this is a perspective that is needed now on segmentation that is universal across all nonprofit verticals. Trying to accomplish this is what gets me excited about working in annual giving. This is why I love doing what I do. And trying to accomplish this requires strategic use of data and analytics, and is exactly why we turn to Pursuant to help us to build that connection with our donor file.
Awesome. Thanks so much for that. And, you know, I would add on top of your ambitious strategy that you're doing this in a difficult time. With a nod to the obvious that, you know, each of us is experiencing, which is that the fundraising landscape that we are all operating in is changing. You know, we know that there's been huge shocks this year to employment, consumer demand, as we're all working through quarantine and sort of landing on our new normal, whenever that is, whatever that is. And so many consumer trends have accelerated, especially towards digital. So, you know, things like adopting and using telemedicine, picking up your groceries via curbside, taking a class at home, you know, on a Peloton. Consumer trends have changed. And so Harmonie, you and team are working to build an annual giving program that not only meets the needs of those 200,000 donors from last year, but those that you're acquiring now and attempting to hold on while donor beliefs and behaviors are changing. And so I think that that's vitally important to recognize that the landscape that you are, or the program that you're building is within this landscape. And so I think that that makes it even more important to understand who your donors are, who your core audiences are, so that as you are designing programs and journeys for them, that you're able to anchor around who those folks are. And so I want to jump in to sort of the gist of our findings and our work. After the strategic segmentation, we next teed up really that core question of, if we are retaining only 18% of our new donors, which are the most valuable to us, which have the greatest potential and the greatest opportunity, which should we seek to acquire more of, and how do we do that? And then how do we pull back from those that are less profitable, that have less of an opportunity for us at the same time? So it's all about resource allocation as Harmonie and team seek to plan and transform their annual giving program. And so identifying and anchoring on these key audiences was our approach. Not just for new donors, but actually for the entire constituency from Children's Health. And so what are some of these key insights? The approach that we follow at Pursuant quite simply seeks to unlock a donor's DNA. And what we mean by donor DNA is what makes them tick. Why are they donors? Why did they give to us? Why do they want to continue to support us? And what's their connection to us? Did they receive services themselves when they were a child? Did their friend receive services? Did their own child receive services from us? Did their grandchild? So there are a multitude of connections. They could be staff, they could be volunteers, they could live close or live far away from one of our facilities. So tons of data elements and variables that could describe them. And so we worked to group the primary audiences that Harmonie and team had, and then to describe them. So our work together identified 3 core types of donors. It's pretty simplistic, but they were the key profiles that stood out to us in our approach that we followed. Some of the biggest differentiators from those different types of donors were connection to children's. And so certainly some of the factors that I mentioned, whether you were a patient family, a grandparent, a friend of a patient, again, staff member, and then also your capacity to give. So things like household income and net worth were meaningful and were actually quite varied between each of the three groups. Demographics varied as well. So if you look over at the folks at the left, let's call them Jennifer, James, and Sarah. They have not only different connection to children's, but also different demographic characteristics that include things like gender, things like age, and then again, some detail related to their capacity to give. And then ultimately, based on our conclusions, these differences really drove home immense messaging and channel implications. And that's really our target here. Again, we're looking to build connection with donors who have very low retention or lower retention. And if we know what makes them tick, then we know how to reach out to them and which program areas are most important. And so I'll share a little bit of what the result was that came of this. So I'm going to hone in on Jennifer, and we actually gave her entire audience segment a name of champion families. That name was selected because it's what makes her different than James and Sarah. She's a champion because she is highly involved, highly engaged, and she is a family member because she was most likely, more than those other two groups, to actually have a child that was served by Children's Health. So really close connection, and then highly involved and actively engaged with us. We performed direct research, and here is a quote from someone like Jennifer. She said her son was treated at Children's, his treatment was life-saving, and we want other children to have the best odds of survival as well. As a family, it's important for us to give back, and so we choose to support those who are nearest and dearest to our hearts. Children's medical is important to both our community and family. So when we talk about motivation and connection, you can read some very explicit reasons why she gives, what that connection was, and then also motivation for continuing to give. If you think for your own organization, would a services recipient also serve as a potential or prospective donor? If so, then I think you might have a very similar overlap or similar audience. For some organizations, it makes sense. For others, it doesn't. But here, that was a really big driver for Jennifer as one of our champion families. There's a ton here on this slide, but the gist are some of the factors that are highlighted in that lightest blue. So each of these profiles that we created aren't simply personas of, for instance, an advocate, a donor, a non-donor, but they are of a very defined audience that we called our champion family. And what makes them unique is that each of those three audiences are discretely different from each other. And so a few things about Jennifer that I'd like to highlight: she is much more likely to be female than any of our other groups. Her age range is actually quite young too. So very few of these champion families are over 55. Think about that, what the implications are for reaching her via digital versus direct mail, or even reaching her via text, because this is a younger audience. And so we're going to make the assumption that she is more digitally active, and even digitally available. A huge percentage of this group are married. And then here's the real kicker, and really what makes the family portion about her unique, is that 94% of this audience has children under the age of 18 at home. Much like Harmonie's, who we heard a bit of earlier as well. And so a lot of folks in this audience were really speaking to parents. If we look over at the right-hand side, we can see that over 68% had a child that received services, so a little validation there. And then lastly, I wanted to highlight one other factor that was also really stark to us, and that was that the annual household income of this audience segment is very affluent, and more so than our other audiences. And in fact, we have some metrics here that also tell us that this audience is not only affluent, but also extremely charitable, and so charitable that they would be a great audience, not only for general level giving, but in many cases for what we would define as mid-level programs. So based on this research, ton of insights that describe and differentiate really who Jennifer is. As I mentioned, those other audiences that we identified were both James as well as Sarah. James tended to be older and more male, as you saw in his picture and image. He happened to be very charitable and even more affluent, but his connection to children's health was substantially more removed. So while he makes for a really good prospect, the job and role that we'll have in convincing him to make a gift again is less likely. And so that's what makes the champion families in particular very interesting to us. And then that last audience that we saw was Sarah. She was engaged and compassionate. She is a substantially younger donor than most of the other audiences that you've seen, but she gives the less, but she is also more likely to show up to events. So certainly a role and a path for both of them to take. But what we're trying to do as we work with Harmonie and team to inform strategies is to allow ourselves to step away from the traditional aggregate profile of who our donor is, and instead identify a discrete audience with a discrete treatment and experience that we can deliver. And so that's what we're doing with Harmonie and team, is to create an experience and a profile for our champion families for that individual that we think of as Jennifer. And here is one of the most compelling ways that we're able to do that. Of course, we saw she's more likely to be female, more likely to be younger, and so probably more digitally responsive, or at least needs to be engaged in an integrated way. We can't rely for her on direct mail alone. But we got even more interesting insight from our research and the work that we did together. And this is really meaningful. So what you see on your screen are really the core program areas or pillars of children's health programs. Certainly they're a lot more detailed and sophisticated than what we see here. And we exposed these to Jennifer, to James, and to Sarah. And we said, almost as if we were having a conversation with each of them, which area, program area is most interesting to you overall to support. And so care, which has aspects of an ER, comprehensive integrated care for children, was evaluated. Community, so the health and wellness and the impact that that children's health means and brings to the community was evaluated. And then lastly, we expressed the work that children's health does from a research and a treatment perspective. And so loosely we called that cures. And so what stood out to us more than anything is that Jennifer, those champion families, are highly motivated by the cures program area, and specifically would be very receptive to learning more and hearing more about this program area at the organization. So all of a sudden, now we have a donor profile for a lucrative audience that is attractive to us from a growth perspective. And now we have some insight into which program area might be the most motivating to her and to engage her. And so what that means is, for example, based on what we've learned, we know that Jennifer is a higher dollar donor and motivated by cures. That could be enough insight for us to design and develop a mid-level program that targets someone like her, that's focused specifically on this aspect of our mission. And so we would craft a case for support as well as response channels around her to reach her and drive that response. I'd say we got an additional level of validation as we tested taglines as well. So we tested 5 taglines that were motivating to our donors, again, to Jennifer, James, and Sarah. And we asked which of these are most motivating to you to act upon. The number one actually across all groups was giving kids a fighting chance. So that popped as number one. We also tested things like our history and our legacy, as well as treatment and what it means to our community. But interestingly, for that Champions family audience, yet again, the research message popped more than anything for this group. And it's what made our champion families more unique than any other audience. So again, relying on that audience segmentation, putting a stake in the ground and saying, we don't have to design a program that's motivating to everyone, but let's really lean into this profile and into this audience. We were able to do that as that audience, Jennifer, stands out for us. So we were really excited about those findings, and we're excited in the weeks and months ahead to really activate upon those as well.
Hey, Matthew, thanks for sharing all that with us. Something that has been kind of going through my mind as I've been hearing about this approach and some of the results is, how did you come to this particular segmentation approach?
Yeah, that's a great question. And there are, quite a few methodologies that we could follow to get there, depending on needs, depending on the weight and gravity of the decisions that an organization is seeking to make. I would say that the approach that we followed for children's health was on the more rigorous side. So I've mentioned the survey or the research that we performed, and specifically that was a really important element in that we designed a discussion guide, and we reached out to the pool of annual giving constituents to poll them and quite simply ask them about themselves, about their giving behaviors to children's health, as well as generally more philanthropic. We also matched their responses to their behaviors. So we looked at transaction data that we had available. And then lastly, we appended third-party data insights to each of them as well. So quite a few factors that go into play there that ultimately created the cluster analysis and informed a cluster analysis that we created, where we looked at all of the differences within the children's health file and landed on those 3 discrete audiences. Sometimes we might land on 4 or 5, but then we've got nuanced differences that we need to activate upon. And where we landed for children's health was that 3 audiences were different enough that would give us direction to create programs and strategies around each of them. I'd add that we also work with a lot of organizations on more directional approaches towards segmentation to simply look at different populations or universes. So I mentioned services recipients earlier. We work with quite a few animal welfare organizations where we might look at quite simply the profile of a donor versus the profile of an animal rescuer or adopter versus the profile of a volunteer at a shelter. And what that does is it gives us insight into each of those audiences and helps us to evaluate fundraising strategies that we might create or generate on our own there. I would say we're also doing a lot of that right now around COVID donors. So many food banks, for instance, have a dramatic influx of new donors onto their file. And so we're doing a very similar demographic analysis as a start to quite simply answer the question of, are my COVID donors inherently the same or different from my existing donors? And should I engage my COVID donors the same, or should I invest in new and different strategies for them? So, so we've got several approaches towards that audience segmentation. Again, what you're seeing today was a bit more rigorous, where certainly we also got insight into messaging and program pillars that are more motivating. I'd add and just sort of conclude this section that we use our Giving DNA Insights platform really to activate all of this. And so what that means is after we have our research completed, we ultimately create a custom model for children's health and load it into our Giving DNA platform. And what that model allows us to do is to listen for those data elements like affluence or connection and demographics. And then as new donors flow into the children's health universe, as we go into end of year, as we work through end of year campaigning, what the Giving DNA platform allows us to do is to recognize who those people are immediately when they flow onto our file. And then what Harmonie and team will be able to do is enable strategies on those donors, in particular for the champion families that roll onto the file. So again, going back to one of the core insights that we found, that only 19% of our new donors are retained year after year. All of a sudden, we are equipped and empowered to identify new champion families that roll onto our file at the time that they do that, so in near real time. And then we can prescribe strategies and treatments to welcome them and to engage them, whether that's a phone call, an email welcome series, a direct mail packet at home or otherwise. So we use the platform, really easy to get started. And regardless of the level of audience segmentation that you pursue, the platform is a great start for us to do that in.
So given all this, Harmonie, I'd love to kind of kick things back over to you. So given all of these insights, you know, how did you sort of take all this, digest it, and then actually apply it and activate it within your organization?
Yeah, so that's always the big question, right? Is now what do you do with all of this information that you've been armed and equipped with? So really the only way, to Matthew's point, that we're really going to be able to create these important donor experiences on a mass scale is by identifying these people like Jennifer and James and Sarah, and then creating messaging directly for them and creating journeys that are specific to them. But given that this is such a seismic shift in the way that we were approaching donors and a donor journey, this is something that we really needed to kind of roll out in phases. So we were equipped with this information back in, Matthew, would you say probably about April of this year? April, May?
Yep.
That you gave this to us. And so the first thing that my colleague Grace and I did was kind of take the 3D analysis and this need to focus on the donor experience, especially starting with that very first gift that was made to the foundation. I kind of took it on a listening tour around the foundation, team by team, to kind of gather buy-in and input from others across the foundation. So we shared it with our corporate relations team and our stewardship and communications team, major gifts, principal gifts, planned giving, really across the entirety of the foundation so that we could take a look at this from a very holistic point of view, and really garnered buy-in from across the board. From there, we were then able to create a cross-functional donor journey work team within the foundation. I co-lead this work team with the director of stewardship, and it's a very small team. There's only 5 of us on it, from annual giving, stewardship, and prospect research. And only having 5 people in the group really allows us to kind of go from big strategy to execution very quickly. It's a very nimble structure intentionally. And then we'll bring in other people into our meetings from other departments as needed. So far, we've brought in colleagues to our bi-weekly meetings from major gifts, gift processing, and communications to have conversations about bigger picture ideas. But the very first thing that this group did was to kind of overlay the different channels that we are acquiring our donors from with the current stewardship touches that our stewardship team was producing to do sort of a gap analysis to figure out where our immediate concerns were that we really needed to address, and found a really big gap that we are working currently to address. But we discovered that the first time donor welcome series that had been beautifully created by the stewardship team through no fault of their own, just through the way some of our systems were set up, were only going to donors who were making their first time gift online. So anybody that we had coming to us making their first gift through a third-party event, or a donor who mailed in a check, or gave on a third-party online platform, none of those people were receiving this welcome series email. And so immediately there's really no opportunity to take people on a donor journey or even to give them that initial thank you to work to retain them, because we're not communicating with them immediately. And so it was really helpful to kind of take the information from the 3D analysis, identify where we had gaps in, or where we had opportunities, and then focus on those opportunities to find the gaps in our processes and procedures. So alongside that, as Matthew pointed out, we really have this opportunity once our donors make a gift to activate them on this donor journey alongside Pursuant. And Pursuant is incredibly helpful on the back end with that. We are spending a lot of time now in Giving DNA and figuring out how we can utilize that, not only just with the personas that Pursuant has created for us, which has been immensely helpful for us in terms of crafting our messaging and meeting our donors where they are, like in their master bedrooms with small children in the background who had a half day of school today, unbeknownst to their mom who scheduled a webinar. But we want to meet people where they're at. And the other thing that Giving DNA allows us to do is it provides or highlights potential opportunities. So it will create segments for us, such as donors who are at risk of lapsing, monthly giving prospects, prospects that are ripe for upgrades as well. So we can quickly build out segments based on those criteria, which is fantastic. The other thing that we've really discovered is that we can kind of flip that model around a little bit. So we had the opportunity recently to launch do a virtual launch of a new group at the foundation called Innovators. It's an exclusive group of engaged philanthropists who give a minimum of $5,000 in support of clinical research initiatives. And we were able to supplement our small invitation list when this launch went virtual. We were able to go into Giving DNA and pull additional people to invite to the launch event. And we were able to do that not only based on giving history, but a lot of that external demographic data that Matthew was kind of walking you through earlier, such as discretionary spending, occupation, age, and gender. And the result of that was a highly targeted invitation list to just over 1,800 people that we thought would be most interested in this event. So we can take the audience and create messaging for it, or if we have a messaging opportunity, we can go into Giving DNA and we can find the right audience for that message as well. The more we're able to tailor our messages to these small targeted segments, the more our audience will come to see that they are known by us and that we truly understand who they are, and we can, much like Amazon, suggest their next step with us in this donor journey.
I love that as our ambition. And just like them telling us what to buy, Harmonie, now you are able to guide your constituents, to the most meaningful interaction and engagement for them. Very cool.
So Matthew, I'd love for you to kind of bring it home for us. How can some of our listeners today start to take some of the different principles we've discussed and start applying it to their own thinking at their organization?
Yeah, absolutely. I mean, I think some of the key things that we've learned from the Children's Health team, and I would say that our common threads with so many of the organizations that we work with overall is fundamentally many organizations have relationships that aren't progressing beyond those initial transactions alone. I think that that's fundamental across the nonprofit space and more pronounced for different sectors within the nonprofit world than others. But fundamentally, a focus on relationships is required. And at the same time, we're really working through fundamental shifts in donor preference that have been accelerated. They already existed, but have been accelerated by this year, by the pandemic. And so being able to follow those donors, whether they were formerly events constituents, whether they were formerly volunteers, many of those constituencies have taken a step back today. And so audience segmentation, understanding who exists within your file and why they are connected, can really be the solution for reframing how we engage them for philanthropy today. And so data and data-driven strategies can really serve as a beacon for all of us to be able to identify what we're working with within our own organization, as well as where our greatest opportunities are, and really serve to support and undergird the strategies and decisions that each of us are having to make right now.
Awesome. Thank you, Matthew. We have some time now for Q&A, but before we go into the questions, I wanted to highlight an opportunity for our attendees today. If you are considering your 2021 fundraising plans and, you know, the news keeps changing by the day, we have an election coming up, we're 6 months in this pandemic, but I can imagine that questions still remain for you. So if that sounds like you, we have a solution that we would love to put in front of you, and we call it the Fundraising Strategy Assessment. And that combines some of the capabilities of what we've seen today in Giving DNA with some of our agency services to give you a strategic plan and maybe help you help assess plans that you might currently have as you are making some of those decisions around where to invest and maybe where to lean in your 2021 strategy. And if you would like to learn more about that, you can find more information at pursuant.com/FSA. All right, so now we've got some time for some questions, and it looks like we've got a couple coming in now. So let's see here. I really like Jane's question, Matthew. Jane asks, how are you able to come up with discernible groups of people? What if all of your donors blur together and you can't pick out statistically significant differences between these DNA groups?
Yeah, that's a wonderful question, and I would almost say is a hallmark of this work. It's really easy to often attempt to generalize based on age alone, and I would say that we often are drawn in that direction. But this is substantially more than really generational marketing alone. The way that we arrive at that group, and I didn't really touch on it a lot today, Jane, but it's a methodology and approach that we use called cluster analysis that really takes all of these data elements and we sort of throw them in the air and see where they hang for all of our constituents. And so what that approach, the statistical approach, allows us to do is to determine where there are areas of concentration of individuals who are the same or similar for different reasons. And so the factors that we identified for Jennifer in particular are detailed here sort of at the bottom, but these are actually factors that identified discrete populations for each of those groups. So it was age, what marital status is, household income, philanthropy, and then whether you had received services. So what I mean by these is that these elements jumped out and predicted uniqueness from each of those three audiences and ultimately created a model to identify who those people are. But the model is different and unique for each project and engagement that we work on. And so in this approach, it's fairly, I would say the answer is a custom model based on the elements that distinguish one group from another.
I'd love to add on to that a little bit, if I may, to answer Jennifer's question as well, a little bit about the difference between Jennifer and Sarah. So when Matthew and the team at Pursuant presented this, the group that Sarah represents was called Engaged and Compassionate. And I really love your question, Jennifer, because I had a very hard time wrapping my head around that engaged and compassionate group. I think to Matthew's point, because so often we think about our donors generationally. And so I assumed that it was kind of going to be those younger millennials, but the truth was it wasn't. So the age was not really what set that particular group apart statistically. They did tend to be younger, but they also were a little bit older as well. Matthew, correct me if I'm wrong, but I'm pretty sure they were the least defined by age, this particular
Correct.
group.
Yep.
They were really defined more by what their connection to children's was, how close it was, and children's health care as well, and by their earning potentials as well. So this tended to be a group that was very close to children's, very engaged with children's, but they weren't ever going to be our knock it out of the ballpark major gift donors, if that made sense. So they're definitely people that we want to continue to engage, but they're not the people that we're going to try to be moving along the donor pyramid and moving up to that major gift or principal gift level.
Thanks, Harmonie.
Hope that's helpful.
Yeah, definitely. I think that is really helpful. And I think it speaks to how with anytime you do segmentation, you're going to have to make decisions about what are the most important data points that qualify someone for a particular segment or not. Because I think just speaking as a marketer in general, there's always going to be things that can make you, can make the lines blurry between where to kind of sort someone. Would you agree with that, Matthew?
Yeah, absolutely. And, the thing that I would say further, I love that Harmonie expressed that there is value for that engaged and compassionate group. And specifically, I would say as a megaphone, as a supporter, as an advocate, as someone who will recruit and fundraise, but perhaps isn't the direct donor with the greatest potential overall. So each of these audiences really brings unique value and benefit. And the simplicity, what's nice about distilling the complete, donor universe into these three buckets is that we're able to identify and talk with them discreetly based on those factors. And to Harmonie's point again, this audience wasn't defined by age. Age was actually pretty spread out, but it was more their involvement type and their potential and capacity to give more that forced them into this bucket.
Mm-hmm. Awesome. I think we've got time for one or two more questions, but I liked this question from Matthew. So he wants to know, how do you track the gaps between gifts? So after, that first gift is given, how do you look at, time to the second gift, the frequency of their giving? Are they giving on a monthly level? Just kind of looking at different levels of frequency and along the kind of spectrum of giving. And he wants to know, is that included in donor DNA?
Yeah, for sure. Awesome question. I love that. So yes, all of those are dynamics that we factor within donor DNA. Specifically, what we looked at and identified for children's health was a life cycle analysis. So we spent a lot of time talking about new donors alone. We also looked at the converse of that, which are donors who had given 2 years in a row or longer, so our key multi-donors. And we saw that their retention was about 65%, which of course is well above their overall retention rate, which was more in the neighborhood of 40 to 45%. So those key multi-donors are the most interesting because they have the highest lifetime value. What we found with that group is while our new donors had nearly doubled in terms of those that were pulling onto the file over the past few years each year, those key multi-year donors had declined just a bit. So that was sort of a punch in the gut, because what we're seeing, again, with all of our new donors flowing onto our file, we don't have enough folks who are graduating to become those long-term, year after year committed donors. So to answer Matthew's question, we looked at a life cycle analysis, and then we also looked at ability to upgrade as well.
Awesome. All right, we've got a minute left, so time for one more question. So Becky wants to know, what characteristics indicate someone is ready to upgrade?
Ooh, I like that, that question a lot. The quick answers that we use is we look at overall philanthropic giving to other organizations. And so Giving DNA allows us to append third-party insights and information. And so we can determine how philanthropic someone is to other organizations. So that's one characteristic we look for. And then certainly we look at traditional RFM factors as well. So we might have a lower dollar donor who's making quite a few gifts within a single year. So we would consider that individual an upgrade candidate for monthly giving. Similarly, we might create a higher threshold where we create an upgrade opportunity for mid-level giving. Both of those are flags that we can set and explore within the platform, and then look aggregately at, this is really cool, what is the propensity and likelihood of our entire file? What is that opportunity to seek upgrades either for monthly or mid-level programs as well? I would also say for each of the three audiences we saw here, we asked them, what's your likelihood to give? And so we were also able to rank these three audiences, and the champion families stood out with the greatest likelihood to make a gift as well. And so we directly asked them because the research gave us that opportunity.
Awesome. Well, that is all the time that we have for today. Thank you, everyone. If you're still hanging on, for the awesome questions that were submitted. The engagement on this webinar has been really great. And as a reminder, you will be getting the recording of this tomorrow, and you can always reach out to Matthew or Harmonie. Their email addresses are right here on the screen. If you had any more specific questions that you had, or wanted to know some more specific details about the fundraising strategy assessment or segmentation, the way that it was applied in this case, we would love to talk with you. And I hope that you have a great rest of your Thursday.
Thanks, everyone.
Thank you so much.